Hello, let me start screen recording. Not screen, yeah. Let me share my screen. I hope you can see me in this. Let's put me over here and we will present. Yeah, sweet. Okay, so today I'm going to be talking about healthcare in Sub-Saharan Africa. I thought this was really interesting because I didn't realize how bad so many of the epidemics and endemics had been in these countries. So it was kind of interesting to get to learn a little bit more about that. So I'm going to share that with you. Let's see if I can go to the next slide. There we go. Illnesses I will discuss are hookworm, malaria, and HIV and AIDS. First one is hookworm, which is this intestinal blood-feeding parasitic roundworms. No fun. This endemic affects 30% of all people in sub-Saharan Africa and up to 50% in northeastern Ghana, which is kind of crazy because if you think about it, that's like close to a third of people are affected by this, and it's most common in rural, impoverished areas, which is because they don't have very much access to clean water, and they like a lot of the time it can be transmitted through dirty water and infected soil and stuff like that. So it really affects them in those impoverished areas, and it can cause growth delay and anemia. So this is really bad for small children and people who are pregnant, because obviously growth delay and anemia can result in early death or just some really sick kiddos. And then of course anemia is never good in pregnancy, so really sad. And they're working towards fixing this, but unfortunately their efforts to fix it, which has been large scale administration of I knew how to say this, benzamidas. You can see the word down there. I totally had that word down earlier. Now I can't remember how to say it, but it's like they're seeing that with these administrations of those medicines, it's coming up that there might be some resistance towards those medicines. So that could be very bad in the long run because, of course, nobody wants resistance to any sort of drug like we're seeing with the COVID vaccine. Not that we're seeing any resistance, but whenever something goes wrong that makes something less effective towards that illness, it can be a very bad thing. So let's see. Malaria, which is a disease caused by Plasmodium parasite transmitted by the bite of infected mosquitoes. So when you think about diseases in Africa, malaria comes up a lot because down there, closer to the equator and stuff, where it's warm and there's a lot of poor water conditions and stuff, mosquitoes are very prevalent, and so is malaria. So this was as of 2018, but half of Earth's population was at risk at that time. I'm not sure what it is now, but for malaria, which is pretty crazy to think about because malaria is not something we have to worry about here in the United States, but it really does affect at least half of our population on Earth. Most cases and deaths occur in sub-Saharan Africa, so that is a really shocking. That was shocking to me, and it's transmitted by mosquitoes, which I just said. So this has been plaguing them for so long, and it's somewhat out of control because you can't really get rid of mosquitoes despite many efforts to get rid of certain kinds of mosquitoes. There's I'm pretty sure it was 100 different kinds of mosquitoes, and 30 of them are the ones that are most likely to transmit it. So when you have 30 different kinds of mosquitoes, it's pretty difficult to control, other than to control by getting rid of the mosquitoes. So according to the World Health Organization, there are 2 forms of vector control, which is insecticide-treated mosquito nets and indoor residual spraying. and that means that's effective. They have seen it's been effective, but the issue is the access to these resources. Obviously, there's just not always access to this, and because it can become pricey in such a large area. So that is another disease. And the third and biggest is the HIV/AIDS issue. It's transmitted through contact with infected blood, semen, or vaginal fluids. It is an epidemic, and it's pretty crazy to think that it is so widespread. But in sub-Saharan Africa, it's home to over half of the world's people living with HIV and AIDS. So that means that like 50% of all the people on this planet who have AIDS are in Africa. So, I mean, sub-Saharan Africa is such a small, like, I mean, not a small portion of the world, but if you think about it compared to the rest of the world, how like the rest of the world, the other 50% is distributed across the entire like Earth population. Just pretty crazy to think about. But progress is being made in these countries towards the majority of people who are infected with this illness knowing of their illness. So that is a huge step in like preventing the spread, because when you know you are sick with HIV and AIDS, you can take steps to prevent from giving it to other people. But obviously there's going to still be the issue of people who do not know of their illness, or they don't care, or with the you know what I mean. But oh no. Okay, so I'm not sure why it says here the vector control thing, because I just changed it. I've had a lot of issues with my Google Slides, but what I'd put down there was, what was it about? It was something about, I had a quote down there. I'll add it back in when I turn this all in, but I had a quote down there about the steps they're taking towards like getting everybody to know that they have this disease and to prevent the spread of it. So sorry about that. So the big idea is that the healthcare crisis in sub-Saharan Africa urgently needs to be solved through stronger governance of the area. Obviously, there's a lot of political issues that are going on that are like stopping sub-Saharan Africa from like uniting against all of these different issues. And I just really think that like with further education and funding, it would really help the people of these countries. But yeah, that's what I have to say about healthcare in sub-Saharan Africa.